Minister, there are up to 10,000 community defibrillators in Ireland, according to the Irish Red Cross. Some of these defibrillators are maintained by around 200 community first responder schemes registered with the National Ambulance Service. But this falls well short of the 275 first responder schemes registered with the National Ambulance Service before the pandemic. The vast majority of these defibrillators have been funded by local communities or through government grants, and yet there is no national database of where they are, if they're being maintained, how they can be accessed, or who is trained to actually use them. For most patients, a quick medical response time determines their chances of survival. For every minute that elapses after a cardiac arrest, a person's chances of survival decreases by 7 to 10%. And with the ambulance response time target set at 19 minutes for a cardiac arrest, this is too late. But despite the failure to reach the response target times in over half of such emergencies, last year, just 268 of the National Ambulance Service first responders arrived at the scene of an emergency before the ambulance. Minister, in a dispersed rural country like Ireland, we need local people to be at the scene of such emergencies within the first 3 to 5 minutes if people are to survive. And while the National Ambulance Service community first responder schemes are struggling to recruit volunteers, we are only scratching the surface with willing volunteers. For example, a pilot initiative supported by Roscommon Leader Company has identified and registered over 480 first responder volunteers in 40 community groups with 234 defibrillators. Yet not one of them are on the National Ambulance Service system. The local community have rolled out an app that not only allows users to ring emergency services with location coordinates, but also identifies where the nearest accessible defibrillator is located and enables the notification of the nearest 6 trained CPR responders, and then talks the person through performing CPR until those responders arrive. This is the type of community innovation, if supported, that can save lives. Minister, in January, 2 children died in choking-related tragedies involving food within 2 days of each other. And as parents, all of our hearts go out to those families. Tragically, choking and suffocation is a significant cause of unintentional death of children in Ireland. Incidents related to choking are quite frequent in children, and in toddlers in particular, when they are learning to eat. And as we all know, toddlers are more likely to put anything into their mouths that they can lay their hands on, and it is a big risk. But the current law only requires 1 staff member present in a childcare facility to be trained in first aid for children. In the case of choking, minutes can be the difference between life and death. And there are many reports of the only trained staff member in a facility being unavailable or even freezing in such emergencies. The then Health Minister, James Riley, stated, "I am very anxious that all people working directly with children in early years sector have the appropriate paediatric first aid qualification." We're still waiting for that to happen. We must ensure that all staff in childcare services undertake and complete a paediatric first aid response course funded by TUSLA and the Department of Children. Minister, on average every day there is a hospital admission related to anaphylaxis, with the highest admissions occurring among children and young adults. Yet most schools and childcare facilities do not have an epinephrine auto-injector for emergency use. Even where they are in schools, because a child has a particular allergy, staff are not trained to use them. It seems that we are expecting the child to self-administer the EpiPen when they themselves are experiencing anaphylaxis. epinephrine auto-injectors should be provided in all schools and childcare facilities, and all staff must be trained in their use of the specific EpiPen on their premises. I commend this motion to the House.
Thank you very much, Deputy Naughten.